For those of us that follow sports, we spend a lot of our time and energy towards professional and college age athletes. So it's really no surprise that youth sports gets a smaller share of our attention, especially when you're talking about the subject of concussion related injuries. So I had a conversation with Dr. Mansi Vakil, a physical therapist and author who devotes a ton of resources towards the education and treatment of concussion related injuries sustained by young boys and girls. Here's our conversation. You're probably the person I most wanted to speak with on youth concussions because I recall as a kid definitely playing football. I had a concussion as playing like Pee Wee League football. And then I may have had one playing basketball where I got undercut and I did like a somersault and landed smack on the hardwood floor. So I'm really glad, you know, that you're devoting yourself to this.
Right.
Um, so just to, for people who may not be familiar with you, you have a master's in a master's and a doctorate in physical therapy.
That's correct.
Okay. And was the emphasis in orthopedics? Is that correct?
That's correct. Yes.
Okay. So how long have you been doing that?
Close to a decade. I've been a PT for close to this is my 10th year practicing.
So can I ask what led you down the path of focusing on concussions in youths?
So I wish and I hoped I had a personal story to this, and because that usually for most people is the inspiration for why they're so devoted to something, and for something like concussions. I would say the biggest inspiration came from my patients itself. We have when I work in an outpatient facility where we see all kinds of sports related injuries, and if you break a leg, you break like an arm. It's I'm not saying it's easily fixable, but yes, it's better off, you're better off with an injury to an arm or a leg as against the brain. And we then started seeing patients coming in with very vague symptoms of loss of balance, dizziness, and problems with some balance problems, not being themselves in many ways, constant headaches, neck pain. And we started realizing that these could be the parents that brought these young athletes to our clinics were not sure if they were able to relate all of this to an episode of a concussion that could, the child may have experienced a week before, 2 days before, at a game at school, and they were just not able to connect the dots that a head injury alone could have caused all of these problems. He's not having balance issues because he has vertigo, or he has neck problems not because he slept wrong. All of that is related to a head injury at school while playing a sport. So my inspiration came from talking to these parents who were just not in it in terms of the knowledge that they had. It was so minimal that I felt there is a need for the population to understand this and have more in-depth information for their own benefit.
Okay.
So the research started, and I researched over 200 papers, and I wanted to see how much literature is out there and how much has been done already to study the effects and the treatments, and what are the options in terms of protective gears and in terms of going to different specialists for the same problem. And even though there's enough literature and research done, it's not really readily available for the general population, which is where I feel the awareness is really lacking amongst everybody, like parents and even coaches to some extent, schools, athletes themselves.
I didn't do a deep dive into the statistics, but I think I did like a short one. And your alma mater is the University of Pittsburgh?
That's where I did I graduated from there. Yeah.
Okay. Yeah. And they had a study and they reported, and this is kind of a staggering number, between 1.7 and 3 million, or there's between 1.7 and 3 million sports recreation related concussions. 5 out of 10 concussions go unreported, according to them, and undetected. It's just, it just sounds like a much bigger problem than what it sounds. When patients and, well, I'm sorry, when these parents bring their children in, does it seem like they're generally, oh, I guess a better question is, what is the level of awareness that there could be a potential concussion when they come to be treated in your facilities?
So I'm seeing a variation. There are some parents who have, if they're bringing their child, their first child that ever played a sport, they most definitely don't have much information. They're like, oh, he's just not, he's not being himself. The very common things we hear is, he has problems focusing, and he was complaining of a constant headache, and didn't sleep well all night. And so this is somebody who has absolutely no clue. This is somebody who's just come in, and I would be surprised. I'm very surprised when somebody walks into a PT clinic with these symptoms, because I'm surprised, and at the same time I'm very happy, because people don't really understand physical therapy plays a huge role in treating these problems. And we could not only treat them after the child has sustained a concussion, but we can also minimize the risk of future concussions. So you'll have that variety of parents who come in absolutely clueless. But then you have other parents who've had other siblings who've played sports in the past, and they sort of remember the other siblings having had similar problems, and they now know this particular child has had a head injury, and something needs to be done about it. So there is this set of parents are looking to dive straight into treatment, while the other set of parents are looking to get a little more understanding, a little more explanation on what's going on and how we could help.
What's like the range of symptoms that sort of alert you that this child may have had a concussion?
Right. So that's the funny part, because surely no two concussions are the same. No two head injuries are going to, they're not going to be displaying the same set of symptoms. You'll always see variations, and the severity depends on the severity of the impact, right? Very basic is that it needs not more than 1/4 of an inch of displacement. That's why when I see these NBA players and these NFL players, and they're all about protective gears and using fancy helmets and this and that, how much does it really take to have for the brain to move 1/4 of an inch? Not much. So the severity of symptoms varies depending on the impact, and in the first few hours, 90% of patients don't even lose consciousness. That's why it's so difficult to diagnose the concussion to begin with. You are not losing consciousness. You're just feeling a little off, a little funny, a little, disoriented for the first few. It could be minutes to hours to weeks. Okay, your symptoms could vary, and some of you may not even have the symptoms. The most common symptom, of course, the number one symptom is headaches. And that probably could be associated with the increase in the pressure in the brain. There's inflammation, there has been an injury, body's response to injury is inflammation. There's inflammation which is causing some increased pressure in the head and in the surrounding structures. So headaches are the number one symptoms you want to look out for. So if your child is coming home from school after he's played a sport and he's complaining of headaches, don't just brush it off as, oh, just, knock it off, or it's nothing. Probably give some more importance to why the headache is there, and especially if it's prolonged, if it's a headache that he's not been complaining of all the time, and if it's something that's really lasting longer than it should. Like usually headaches from migraine headaches from dehydration don't last that long, and once you correct the factor, then you take a migraine pill or you hydrate yourself, the headache should be gone. But these headaches sort of linger around longer, so you should look out for headaches for sure. Others have neck issues. Sometimes with a lot of head injuries could come from the neck being twisted or the neck being impacted in the wrong way. So a lot of patients or athletes will have symptoms of neck pain and instability in the neck, just not feeling well in that area of your body. Some of the other symptoms I've seen is just depending on what part of your brain or what lobe gets affected, you will have memory problems, you'll have poor attention span, you're just not in it, you're like, I don't feel well, I don't know why this math problem is taking so much time today, as against I could have done it much more easily at another time. So these are very subtle signs, and not everybody takes them seriously. We always want to discount. We always want to be like, it's probably not my day, and just be like, all right, some other time I'm sure I'll perform better. And these are the people who end up getting hit again because they felt they were nothing was wrong to begin with. They go back to play the same sport, and because they're not 100%, their chances of being hit are pretty high, and they get another one, and then another one, and then the number of episodes start building up, and that's when we start seeing that the recovery is no longer straightforward, and it's poor prognosis. Things just start going downhill after that.
It's interesting. And let's dive in. And you and I spoke on this a little bit before, like the culture, especially for men and young boys, the culture, especially here in the United States, and I'm pretty sure the other countries, we're encouraged to push through pain and be tough. And there's some value in that. And to some degree we have to, but from what I understand, there's some dangers of sustaining a concussion and then re-engaging, with whatever the sport is. So what are the risks for a young person who sustains a concussion, doesn't get treated or diagnosed, and then sort of, re-engages with the sport, like in terms of long-term damage or worsening conditions?
Right. So I believe, any mental, like talking about mental problems and mental illnesses, and that's my biggest concern, to be honest, is psychological impact, because nowadays, it's all about performance. It's all about being out there and having the spotlight on you all the time, and not having to having anything take that away from you automatically has an effect on the child's mental health. And what happens with the neurological changes associated with the head injury, what happens is you sort of start going into depression. And because you are not sleeping well and you have these headaches all the time, you're not eating, you have loss of appetite is also very common. If I put all of that together, I would not be able to survive for very long. If I tell you to survive with poor sleep and constant headaches and not getting to eat right, if you're going to live a life like this for weeks and months, what happens is now the next step is you're slowly socially withdrawing. Okay, you don't want to meet anybody. You just don't feel like, you can't go and play the game anymore because you're not up for it. And you're going through your protocol, and they're looking for, probably things are looking pretty on the results and on your score sheet or whatever. But personally, you have slipped into what commonly is a combination of anxiety and depression. And that leads to social withdrawal, and ultimately the long-term effect, of course, would be depression leading to suicide, or Alzheimer's has kicked in and dementia has kicked in somewhere along the path and made things even worse for you.
That's pretty staggering, especially when you're talking about a kid whose brain and their body is still developing, and then you have this one incident that disrupts all of that. You mentioned in our last conversation something that was surprising to me at how young girls are at risk with concussions, and that's quite frankly something I'm not surprised by, but really wasn't on my radar. Tell us a little bit about how it affects young girls.
Right. So I think it's very common between young girls or boys. I would say if you're under the age of 13, your brain hasn't completely developed yet. And if you're going to damage a portion of your brain that's not even developed, then it's not going to develop the right way after that, right? So you've caused a permanent damage, so sort of speaking. And women, I think girls are more vulnerable because of just structurally we are, the structure, our body structure is different. And that definitely, when we are trying to play a sport with the structural changes, keeping the structural changes in mind, it does make girls more vulnerable. And there's also, as they grow about 13 and up, of course, we also have some hormonal differences in our bodies that again make us more susceptible to injuries, more so impact injuries as against the boys, like our other counterparts. So girls definitely, but also girls tend to recover a lot better too, because the chances of girls reporting an injury are much higher. So the boys are not easy with that. They're not going to come home and say, "Mommy, I got hit in the head." No, but the girls will. Now, again, on the flip side, sometimes we tend to over-report, right? And so you don't know when to take somebody or something seriously. Like if I'm gonna have a child come home and be like, "Oh, complain about something every day," I'm like, you know what? You're just like crying. You're just fake crying. So that too is a problem. That's why it's so difficult to diagnose something in that age group.
I guess this highlights the importance of getting different perspectives. I wasn't even factoring, like I was factoring in with between young boys and young girls, maybe bone density, muscle density. I wasn't
Sure.
even thinking about hormonal. And
There's hormonal. There's also, yeah, the alignment on the neck is different. There's a very subtle change, the very subtle differences. But when it comes to an impact injury or a collision injury, they sort of it's a bigger picture. It makes a bigger difference.
so, since a young developing person's body is vastly different than an adult's, in my opinion, are the protocols to treat young people different than the protocols to treat an adult person who suffered a concussion?
Right. So definitely, the protocols are different not only for age groups, but they're also different for different sports. So I don't think you have a lot of these. The Pediatric Association, the American Pediatric Association, has certain protocols. Every school, in fact, has their own protocol for return to play, and they are very specific about what they're expecting to see in these groups of athletes as baseline parameters before they are allowed to return to sports. So yes, there is a difference in the protocol that you'll follow. With the adult population, I'm sure when you look at the protocol, you are also looking to help them with medications that you may not be that comfortable doing with the younger population. I'm not going to dose them up with pain pills, and I'm not going to dose them up with sedatives or anti-inflammatories as much as I would be comfortable doing that to an adult. So that's also a vast difference in the protocol.
It seems like what's in order for a kid is more of a community-based approach to treating that kid. And one of the things that came up, if you recall, is getting the educators involved, because it seems like there's a risk of the students, teachers, or the school staff of not having any visibility to a kid suffering a concussion and perhaps not knowing what they need to do on their end to treat them. So is there any discussion in your area in getting the students or the young person school involved?
So unfortunately, I haven't seen much of that happening. I do know that nurses, every school has a nurse, and I believe they're trying to get more specific with the kind of nurses they hire, somebody who's more specialized in head injury, somebody who's more knowledgeable with what to do in case of concussion. So I see that trend changing just a little bit, where the support staff in terms of the medical team seems to be a little more knowledgeable. But when it comes to the other two big populations that I believe should benefit from being educated would be parents and teachers, right? Because you have now, we also see a lot of integrated schools nowadays where you have kids with ADHD or being on the spectrum integrated with the normal population. And when these kids go out and play sports, things are a little different. If I have a kid with ADHD trying to play tackle football, and if that kid gets impacted, then it's a totally different approach. Why? Because to begin with, the athlete already had attention problems, and sort of you have to even coach them differently when how to play the sport, because they have something else going on in their head in terms of how things go. So I feel parents and teachers should definitely be educated I have interviewed parents from some of the best school districts in my neighborhood, and I've asked them a very simple question: when your kid goes to play a sport, do you guys have an orientation, or does the athletic director or the coach have any dialogue with you about what to expect in terms of head injury, or whether to expect anything unusual, whether you should look for some of these subtle signs and symptoms when the child comes home? None of that has been done. So I feel we have there is scope for learning there, so parents could be educated, and teachers, because that math problem that I couldn't solve, or my child couldn't solve at home, the teacher would probably assume something else. The teacher has to be kept in the loop that we are suspecting a head injury, and unless she knows what we're talking about, it's going to be very hard for her to relate to this as a real problem. Okay, and that's, our educational system is definitely lacking that currently.
Should there be more and I know this is like kind of a taboo, but like more government or legislative intervention, or like, something requiring, in addition to the protocols that, you have medically
Sure.
so should there be something, I don't know, dictating, that a kid should take a break, or there should be certain communication?
Right. So I'm sure they're doing that at individual school and district levels. They are probably, like I said, there are flyers being sent out, but I feel like there's nothing standardized across the board. Like if Department of Education and Board of, like, everybody came together and said every school, be it a private school, or a government funded school or an Ivy League school, no matter what the social, what the economic status of the school or the people at that school is, we should all follow the same protocol, because I don't think any of these Ivy League school kids that are playing at school level end up playing for the NFL. I don't think so. And the population that actually is playing for the NFL and making allowing these big teams and to make money, they mostly are coming from the lower socioeconomic school settings. Okay, and these are the kids I want the government to protect. So give them the more expensive headgears instead of giving them to the Ivy League kids who are not going to play after a few years. They're just doing it for the fun of it, and because their parents have the funding for it and they want to look pretty uh, in their parents' social group. If they are not the ones going to the NFL and risking their lives playing for the bigger league championship, with the big league program. So that's where I'm worried for these other kids who are playing very passionately, but they do belong to, I'm not saying all of them, but most of them do belong to a lower socioeconomic school system that is not getting any funding for better protocols, for better coaching, for better education. All of that costs money, and nothing. And if you don't have if the school doesn't have the funding, the kids are suffering.
Is there one country in particular who is a better leader at that kind of thing?
I feel Canada is doing a fantastic job. They totally eliminated tackle football, as against America, where they say if you can't handle, if you are, I know of a school, I forgot the school district, but there was a school district that sent out letters to the parents saying, oh, we are going to experiment with flag football for a bit, because we're a little concerned about the head injuries and concussions. And the coach said 95% of the parents opted out. They said if the kid's going to play flag football right now, then when they do grow up and they're up about 13 years of age, they'll ultimately have to play tackle football, and our kids will not be as prepared as the other kids then, because we have sort of changed the rules on them earlier on. But they are not understanding the consequences and the dangers associated with tackle under the age of 13. And these things, I could really, it drives me crazy when I read such things, because then you can't blame anybody else. It's just the parents. And
Yeah.
if these are the parents you are trying to educate and talk to them about safety, you're wasting your time. So it's a tough battle there.
I've seen it up close and personal. It's a combination, it seems like, of ignorance, maybe some level of dissonance and denial. You said something that I loved, or you wrote something that I love, and I'll make sure I get the quote right. You'd like to make every sport concussion free for our youth. I love that. Um, Being here in America with how much America is in love and other countries are in love with their sports, that sounds like something. It sounds like a very challenging endeavor for you. How in your perfect world, how do we go about making sports concussion free for these young kids?
Right. So I feel like I said, the first thing you want to do is understand what a concussion is. Like, there is so much. It's so confusing right now for people because they don't even know how to define it. Like, let's understand what a concussion is. Let's understand how it's different from other forms of head injuries. Let's then look at the wide variety of options available to prevent. Like, there are so many things you can do. I've met with coaches that have coached football for over, I don't know, for decades, and they said not one kid ever sustained a head injury in their team. You know why? Because of the coaching style. Okay, you want to make the game safe, it's totally in your hands. You don't have to. I know it's all about, when people talk football, your mental image about that sport is just all aggression, and it's just that rush of hormones driving you crazy, or just you don't see that as a safe sport. You can never. Just for, by the way, I mean, now that NFL, it's and now currently NFL itself, we're seeing so many players, they're dropping like flies, this season especially. I'm not saying it's because now people are more aware of the head injury problem, but even if I'm thankful that they're at least getting reported, right? So look at study their moves, change the rules. If there are some rules that are going to keep them from impacting each other, to a minimum, you don't want. I'm not saying totally change the organic nature of the game, because then it's not football anymore. It's not American football anymore. But I think by using the right coaching styles, by tweaking the rules just a little bit after studying what exactly is causing these injuries to occur to begin with, by just using some preventive techniques, like I said, I've mentioned to you even before, like, prevention is highly possible here. If I have poor, like I said, we have a core muscle in our neck, and nobody knew that. And if my core muscle in the neck is weak, I'm already feeling, and on that weak core muscle, I am not only going to play an impact sport, but I'm also putting a really heavy helmet on it, right? So am I prepared to actually go and defend, and am I prepared to actually go and hit somebody and feel safe about it at the same time? No, I'm not. You're not ready for it. But guess what? You could be ready for it. You could be, because what happens with a stronger neck muscle, even if you have suffered an impact, the amount of jarring and the amount of nonsense happening in your brain could be minimized, just because you were able to counter that with a stronger neck musculature. And nobody knows that. People think it's okay, you're all about pumping your biceps, and you're all about getting all muscular arms and legs. But you know what? You can actually train muscles of your neck to make sure that if the impact happens, you will automatically, your body will be able to correct that.
Yeah, that's a great point. In all my years in playing sports, and even now when I go to the gym, every woman also, I see them training or trying to build muscle from the neck down.
Sure.
Yeah, so that it seems like an opportunity for people to seek out better training techniques.
Right.
If you're engaged in those kind of sports. So what besides the typical sports like football and maybe soccer. Are you seeing any kids that are participating in some of these combat sports like boxing and mixed martial arts?
Yes, so those are the other ones. I actually see a lot of you see gymnasts, yes, lacrosse, because some of these sports you're not wearing any protective gear at all. So if you break the rules, the rule is not to hit in a manner that will cause a head injury. But of course, the human nature is to break the rules, right? So if you break the rules in some of these sports where players are not wearing protective gears, yes, you are looking at a potential head injury.
So are the kids that participate in the combat sports are do they have more severe cases than some of the kids that play football or basketball or soccer?
I feel in terms of severity, soccer and football are definitely, basketball not so much, but soccer and football are on the list, on top of the list. And bicyclists, because when you're bicycling and you don't have a helmet and you hit that ground head first, that impact is pretty bad as well.
So who, besides the parents and the coaches, who would you like to see more um, collaboration and cooperation from, whether it's the government sector or the medical community?
Well, I would love to collaborate with neurosurgeons. You know why? Because they're seeing these people all the time. Neurologists are seeing these people all the time. I would also want for neurologists to to sort of team up with psychologists as well, because when I mentioned to you the behavioral problems and this and that, you would probably have a psychologist who's meeting with an athlete who's constantly talking about being depressed, not being able to draw the connection of that with the head injury from a sport or whatever. So psychologists, psychiatrists, neurosurgeons, sports physicians, we could all team up and make this world a better place in terms of eliminating concussion.
Have you ever had a concussion yourself?
Not yet, or not that I know of.
Let me tell you, you don't want one. It, it's not fun. There's nothing fun about it.
I hear you. I've heard it from a lot of people, and it's something that's every day is a challenge for these people, and it's not easy.
Do you have an idea or a vision on how to hold certain people accountable that clearly and defiantly, just, I guess, put kids in peril when they know they've suffered a concussion, and they put them back on the playing field?
Right. So it's definitely, I would say, the quality of doctors that do the assessments. If we would have better doctors on the doing these assessments and deciding when there should probably be an outside doctor, is what I believe. Because if you have a doctor that the team has assigned, he probably, the team, the director, the owner of the team, and the director of the team. And the doctors, they sort of have an ulterior motive, right? Like they want the player back ASAP, especially if it's one of the best players. That doctor is going to be like, "Oh, you're fine. We'll hold you out for 48 hours. We'll check for a few things there and there." And for most parts, these doctors give the screening tools they use. The patient, after taking like anti-inflammatory pills or taking pain medicine, sedatives, for most parts, they within the next 48 hours, they feel okay. And that's when I would blame them, because you haven't done a thorough assessment. And some of them actually should wait to do the assessment after a week, because some of these symptoms don't even surface in the first 48 to 72 hours. It takes a little longer than that for the actual symptoms to start surfacing. So if you have a doctor who's part of the team and who's, his intentions are for the team to benefit from, a good player, and then I would totally regard that assessment as wrong. Like I would expect an outside doctor to come and tell me what's the status on the progress for this athlete. So outside doctors, more specialists. I came up with my own protocol and I'm working on it. I feel even physical therapists could participate in assessing these athletes, because a lot of things that these doctors don't assess for, one of them is agility. It's so important to test for agility after the athlete has sustained a head injury, because that does get compromised. And if my agility level is not back, then when I go back on that field, my chances of sustaining another concussion are pretty high. So agility testing does not get done. Aerobic capacity, my lung capacity could be very compromised after I've sustained a concussion. None of the doctors are checking for it. They'll make you walk a little bit, see if you're short of breath. It's a very superficial assessment. Why not do a very in-depth VO2 max assessment of the athlete to make sure his lungs are functioning just fine. So if the athlete goes back to playing, he won't be short of breath. And because then you're not putting in your A game, and then somebody's going to come and hit you, and you'll get another concussion. So agility testing, aerobic capacity testing, there are a lot of things that are not currently being done, and I want them to start doing those. And only then, once we've checked off all these on the list, all these components, that's when I would say that the player is ready to go back. But now nobody's doing that.
Are you noticing any troubling trends
In terms of
severity of injuries, in terms of maybe malpractice, in terms of poor
we're seeing that
monitoring?
all the time. I actually I spoke with the lawyer. He a litigation lawyer who specializes in head injuries, and he said in the past, I think in the last 5 years, he's seen the number of cases go up dramatically, because there is shit happening everywhere. And it's now more people are now coming after even college level, the leagues. It's not just about the NFL. I'm sure NFL has, there are, I already feel bad for the players that were, the lawsuits that happened, and I feel they were underpaid. I would definitely have seen, hoped for these players to be paid more, because you're literally taking away lives, right? And I feel like at school levels, at college levels, a lot of sports organizations are going to get in trouble, because a lot of parents are now really getting more, at least the ones that are not turning a blind eye or and the ones that are pretending to be oblivious, those are the ones that are really going after coaches and going after athletic trainers and directors who believe it's okay to just knock it off and just go back to playing even after you have had some very obvious signs.
Well, it's been a pleasure chatting with you. Do you have do you want to share any social media or any
So right, I would love to, because I feel if your audience is hungry for information on this topic, there are resources I would definitely want them to check out. I have my own website. It's www.concussiontalks with the S, with an S, it's a plural, concussiontalks.com. I regularly post blog articles on it, be it related to injuries or be it following something as simple as following a concussion diet. What are the right things to eat after you've had a head injury? That'll promote healing and quicker recovery. So there's a lot going on that website, so they can definitely check that out. I'm about to update my Facebook page, so I'll definitely send more information about that on my website once it's up and running. Most importantly, I published a book that has tons of information. Like I said, I researched over 200 papers and ensured that we had the most updated information about the injury. It doesn't talk only about the injury. Definitely, if somebody's looking for, it should be treated like a Bible, something you will go back to each time you want to know something, because it has treatment options, it has the list of specialists you should see, it has assessment tools that have been used, it has signs and symptoms and red flags and changes that occur in the brain. At the same time, it sounds very boring and something you would easily not find interesting to read, but it's not a textbook. I have converted the language to sound less intimidating, not very technical. So the reader is absolutely going to feel at home if he's gonna start reading. It's a more colloquial language based book. So the name of the book is Concussion and Sports, and you can check out the ebook. I'm also going to run a promotion where I'm going to give out free ebooks for a week. So look out for that link on my website, or you can go on Amazon and look for it.
Very good. We'll make sure to put the graphic and the links.
Sure.
We'll put those. Would you recommend also the Center for Disease Control as a resource?
Sure. Yes. They have updated information on helmets and what are some of the newer safety gears to use for sport. They have their own protocols. Very interesting. Yes, CDC is definitely the place to go if you want generalized information or you're not sure where to begin.
Okay. Well, thank you again, Dr. Vakil. It's been a pleasure. And yeah, we'll include all your information where people can get access to you. And maybe we'll have a chat sometime soon.
Excellent. Thank you so much. It's been an honor. I really appreciate your platforms like yours, because we need more of these to get the word out. So I feel that you are doing a great job hosting these podcast interviews on your platform.
Thank you very much. Okay, so let's wrap up, and we'll talk soon, and take care.
Sure. Thank you very much.
Bye-bye.
Bye.